Uh, Good afternoon, everyone. I'm Lori Lowell, the Executive Director of Home Haven, and I'm happy to welcome everyone to this program on dental health. And before I turn it over to Pat, I just want to give you a little bit of housekeeping. Please turn off your microphones. So you can do that directly, or I might, if I have to, I might just mute everyone. So please mute yourself. And we suggest that during the presentation, you change your camera view, which is in the upper right corner of your screen. It says view. We suggest you change it to speaker, which will enable you to really focus in on our speaker today and her slides. Okay. And if you have any problems with your connection or any issues, please call the office and talk to Kate. So it's my pleasure to introduce Pat Allen, Chair of the Home Haven Health and Wellness Committee. And she and her committee have organized this program and many other presentations. So thank you, Pat. I'll turn it over to you.
Okay. Thank you, Lori. And I am really pleased to have this presentation today. And I must tell you, Aniva, that I think you have been the hardest speaker to find because, I would ask dentists, oh, who knows a dentist who would come out and speak to us? And nobody gave me any names, maybe because of what we were talking about before. So I am so thankful you're here. Niva is a dentist, and we asked her for a bio, and she wrote that I'm an educator and a dentist. My goal is to educate my patients and the people around me about oral health and its impact on well-being. I am passionate about teaching mothers about the importance of good dental hygiene and its correlation to their children's overall health. I am also committed to being a resource and mentor for racial and ethnic minority youth who are interested in dentistry, as I see it as a way to reduce health disparities and inequities. And I think that is probably very true. But you also work at Fairhaven Clinic.
Yes, I'm the dental director at Fairhaven Community Care.
Right, the director. I thought that was it, but I didn't want to elevate you unless I was sure. But Fairhaven Clinic, I did a little bit of volunteer work there when I was teaching, and it is impressive. It is a real neighborhood community health center, and for you to be there, that is wonderful. I applaud you. It needs excellent clinicians because the clientele needs excellent health. So, Aniva, I am so glad that you are here today, and thank you so much for being willing to share your time and expertise with us.
Well, thank you for having me. It's a pleasure.
Well, let's put your screen on. And
okay. Let's share screen. Can you see my screen?
That's good. Yes. Excellent.
Yes. Okay. So the title of this presentation is Oral Health During the Golden Years. So the very first thing that I wanted to speak about is the common dental disease, okay? So we have tooth decay, okay, cavities, which is created by a buildup of bacteria, which is the plaque that we often see. You can see some of it on the, the picture. And that's it. And plaque has a tendency to actually eat at your hard enamel, because the enamel is the top layer of your tooth, right? It's the layer that if a little piece broke, it doesn't hurt because that layer doesn't have any nerve. Then you have also another common dental disease is gum disease. That's when the plaque builds up at the gum line and it creates gingivitis. And gingivitis is when it's just at the gum line and it's actually provoking that redness and slight swelling of your gum. Now, when that plaque stays for a long time and it goes subgingival, so under the gum, like right under and looking at the root of the teeth, then it can damage the bone that is underlying, that is supporting your tooth, and then you become periodontitis. And when that bone is damaged, then you have the risk of tooth mobility and tooth loss, and that also can be risk factor for some other disease like lung and heart disease. And I just want to pause to ask you, if you have any question at any time, please do not hesitate to interrupt me, okay? The other thing that I wanted to talk about from the beginning was all of the oral hygiene aids, because I think that for a lot of people, as they get older, sometimes it may be difficult to have the same dexterity as when we are young, especially when people have issue of arthritis and other ailment. So you have your manual toothbrush, which is like, the one most of us are used to. You also have your electric toothbrush, and some electric toothbrush actually have bigger handle than like your normal toothbrush. But like I show in some of the picture, you have the modified handles toothbrush. And if you Google it, like, Amazon and things of that nature have different kind of toothbrush. And one of the toothbrush that you see on the top, on the extreme, on the left, you see that one has a different form because it has like kind of three. It has brush on the side and brush in the back. And so that's a brush that's kind of embracing your total tooth. And that is also helpful when for some reason people have issue with turning around and being able to go around the tooth. Floss. So flossing is also very important. You have the dental floss holder that can be helpful, because I know that even for patients who are younger, it can be difficult to actually go and use the floss thread. I know we also have on the market the floss toothpick. So the toothpick is like, it has the little plastic and it has a toothpick on one side and the floss in the middle. And I always tell my patient, whichever floss you use, it really doesn't matter whether it is on a toothpick, whether it's on a floss shredder. Floss is floss. The most important thing is to floss daily. And then you also have the water flosser, who have become better over the years, which are also for like, some people like that. And people really like the fact that the stream of water is also kind of like a massage for them. Of course, you have your fluoride toothpaste, which is really important. I know that as people have become, I would say that there's an issue that presents more often with educated people who are really interested in where fluoride is good for you or bad for you. And they'll be like, what's a chemical? But it's a chemical occurring naturally in nature. The way fluoride was discovered is because in the state of Michigan, people had really dark teeth. But at the time when you had a lot of decay, those people did not have decay. So people started to look at how come, and they realized that it was fluoride in the water. And actually nowadays, when we apply on children like a high dose of fluoride, it darkened the teeth, but it also stopped decay. So when kids are very, very small, instead of drilling, which could be traumatic and not easy to do on little people that may be like little wiggle worm, is you can apply this and just stop the decay and explain to the parent that, yes, it's gonna look dark, it's not gonna look nice, but it's a baby tooth, it's gonna exfoliate and they're gonna have their adult tooth. And of course, we want to use mouthwash. And for mouthwash, I always tell people, whichever one you like, just like toothpaste. People sometimes ask, what is the base toothpaste? all toothpaste in terms of ingredient have the same base. And then it's really a different flavor, you know, whether you want mint, strawberry, spearmint, strong mint, but that's definitely a personal choice. I know that for mouthwash, I usually do not personally like the one with alcohol. I find them too strong for me. But you know, some people like that. They feel like, oh my God, like I feel super clean. So whichever one works for you, that's the best to me. The most important thing is to use to brush every day, twice daily, to floss at least once a day, to use toothpaste, fluoridated toothpaste, and to use your mouthwash. Okay, so, and I know that as we get older, many of us have dentures, whether it is full, complete denture or partial dentures. So one thing that I'm very, very emphatic about, and I tell my patient every single day, is take out your dentures at night. Some people I know sleep with their dentures, don't want to take them out because of the aesthetic reason. But the thing is, I always tell my patient, dentures, they're like shoes. You don't go to sleep with your shoes. Dentures are your shoes of the mouth. Take them out when you go to bed. And also because, you know, you need to clean them. So you need to take them out, usually put them in a glass of water, put the denture in it, put your cleanser tablet. You know, there's the denture cleanser tablet. They're available over the counter. The next morning, brush your denture with a toothbrush. In the image, you see like the denture toothbrush is very important. It's not your normal toothbrush. And also a denture toothpaste. Do not use your regular toothpaste. Your regular toothpaste is abrasive and it will damage like the pink base, the resin that you have that hold the teeth. So use a denture toothpaste, or if you don't have a denture toothpaste and you don't want to invest you don't want to invest in purchasing one, use your mild dishwashing liquid. Just use your dishwashing liquid that is mild and wash with it. Rinse it really good. If you have to store your denture for one reason or another, make sure you store it in water, because as it dry, again, you see your resin kind of like scabbing and becoming dry. So it's very important that they stayed in water. Just put a little water or put a damp cloth and put it in there. Another thing that I often tell my patient, do not try to repair your denture yourself. Some people feel like, oh, it just broke. Let me get some super glue. And they will glue it, and then it becomes something totally different. And then they come and like, hey, doc, can you repair that? Well, you did a lot of repair to it already. So I always say, come. If you have to have, if it broke, if a clasp, which is the little wire, metallic wire that are holding break or something like that, come and we will gladly repair it for you. The same way, if it broke in half because it fell or something, just come, we will repair it for you. Also, if there's any issue, sometimes people get new dentures, and as we get new denture, it's just like a new shoe. That's why I like to say it's a shoe of the mouth. You know, sometimes when we get a new shoe, particularly leather, you know, it has to breathe. It has to get like used to your feet. Then you have to walk with it before it feels like, you know, it's comfortable. And so after a while, if after a week or two it still feel uncomfortable in one reason or another, come for adjustment. Ask your dentist for adjustment, because poorly fitting denture cause sores. They cause sore, they cause infections, sometimes because what we call gingival hyperplasia. That means like you have like overgrowth of your gingiva, because like your gingiva is just not seated correctly in the denture. So come and have it adjusted. You know, it's usually, and actually when the denture is new, there's a certain number of adjustments that are totally free, and it's normal for a patient to come back and say, I need adjustment, this hurt or this, because as you eat, you can feel better if something is bothersome in your mouth. So another thing that is very important as we get older is systemic disease. So there's a higher risk of gingivitis and periodontitis with diabetes. And that's a big reason for that is that diabetes creates inflammation. So we become more susceptible to infection and slower healing. So if you have diabetes, it's very important that you take really good care of your mouth so that, you know, there's no issue of gingivitis and periodontitis, because it will take longer to heal. And also that if your sugar is not regulated and you have a high inflammation, that will also create higher risk of periodontitis, because periodontitis and gingivitis is gum inflammation. Also, another thing that is that goes with systemic disease, whether it is diabetes, high blood pressure, and others, is that you're more prone to cavities. And part of it is because some of those disease and the medication that we use to help them actually create dry mouth. And as we have dry mouth and some of the medication, we also at greater risk of oral thrush and candidiasis, which is a fungal infection that usually look really white on the tongue, and it sometimes it gets even in the throat, and it's a little irritating. And of course, you know, like anything, one of the most important way to prevent gingivitis and periodontitis is good oral hygiene. So when you have poor oral health, it does have association with poor health in general, so diabetes, high blood pressure, and vascular disease. So it's very important to, you know, take care of your mouth, because I know your mouth is kind of hidden, you know, in a way that like you see your lips and you see, but you don't necessarily see the inside. And some of us know that in the inside there are things that are not going well, but people don't always see it. However, it is important for all of us to know that your mouth is connected to your body. It is not disconnected. So take care of your mouth so they can take care of you. And like I say to my patient a lot of time is most of what we put in our body, we put it through the mouth. So don't neglect your mouth. Drug interaction and oral health, we touched on it a little bit, but oral health, I mean, as we get older and sometimes we have to take more medication for all kind of things, whether it's diabetes, blood pressure, allergies, seizure, Parkinson, Alzheimer's. A lot of medication create dry mouth. So as one has more medication to take, you know, one of the biggest results of those medication is dry mouth. And dry mouth, of course, will create poor health, because one of the things is when you have dry mouth, that means you don't have enough circulating saliva. And your saliva is really important in moving bacteria around and in making sure that as we eat, stuff does not stay and plaque does not you know, solidify more easily. So it's very important to pay attention when we have dry mouth. Again, this fungal infection, we talked about oral thrush earlier for people who have asthma medication and lung inhalers. We have the risk of gingival overgrowth with calcium channel blockers, or some of the high blood pressure medication. One of the common ones is things like amlodipine. We have immunosuppressant drugs for people who may have to have a transplant or things of that nature, that also are often the cause of gingival growth. And also you have seizure medication. So mucositis is when you have the inside of your mouth, the tissue that is on the inside, the layer on the inside is irritated and inflamed, and that is often due to chemotherapy medicines. Ulcers are also caused by chemotherapy medicine, and those can be very painful to people because, you know, they can be in the mouth, in the or mucosa, and sometimes even going down the throat, and that will make it difficult even to appreciate food. And of course, many drugs that we take for many different kind of ailments actually create a taste change. So people have metallic, salty, and bitter taste that is due to drug interaction. And sometimes they don't think of it, they just say, oh, you know, but this doesn't taste the same way. And it's a lot of time some of the medication that we have to take. So, and of course, dry mouth can be so, it can be so aggressive that it creates xerostomia. And xerostomia is the same thing as dry mouth, but we call it xerostomia when it becomes like a clinical case. And as you see with this tongue, it's kind of like reddish. You know, you kind of see the line in between. So it doesn't look like your regular tongue. And that's because you have the reduced salivary flow, which makes the tongue be really dry and also create an increase in cavities. You also see in case of excessive xerostomia, people who have like acid erosion of teeth. And that's when people don't have cavities, but it's like the teeth become like they erode. And also sometimes when the mouth is really dry, you also, as you get older with just eating throughout life, because we don't always think of that, but as we eat every day, your teeth get shocked. You know, sometimes we eat stuff that are hard, or we do things, I mean, it's just like they work all the time. And so you also have, with the dryness of the teeth sometimes become slightly brittle. And then you have halitosis, which is when people feel like, you know, their mouth doesn't smell good. And that has a lot to do with dry mouth, because dry mouth will create, you know, that halitosis. And also when the tongue is really dry, people feel like they have the burning mouth syndrome. Some people will come and will say that they have a sensation of burning of the tongue, and that's because it gets so dry. And of course, as you see on that tongue, one of the sign that you see is that fissure tongue. Your tongue look like it has like those little crevice inside, and you know that like it's pretty dry. And I thought that, you know, as we're talking about xerostomia, that it would be important to talk about some of the dry mouth products that out there. And I put a sample of a lot of different things because I'm not advertising for one or another. But, you know, you have your fluoride toothpaste that Biotene was one of the very first company that work in making sure that they alleviate dry mouth. So, you know, they have your toothpaste, they have the moisturizing spray, which is kind of like when you have the spray when it gets really hot and you put water on your face, so you spray your mouth. You have the dry mouth lozenge, which is kind of like you suck on it, kind of like a candy. You also have the gum. So chewing gum in general can help in making in increasing the flow of saliva. So whether it is those one, I mean, those one are very specific, but if you want to chew gum, I would say use the one that say that they are recommended by ADA, the American Dental Association. Some brands, like if you look in the back, it will say ADA recommended, and a lot of time those have xylitol instead of having a lot of sugar, which is good for your mouth. And of course, you also have like those melt is kind of like you put, and I've tried it one time because I had a patient that told me that the one they had didn't taste really good. So I tasted it because, you know, then you know, then for information. And so you put it on your tongue and it literally kind of melts after a while, and it makes you feel fresh and moist. So just for you to know that when you go to your pharmacy, or whether it is Walmart or Target, they usually in the section where you have the toothbrush and stuff, and maybe you have more choice in pharmacy, but they have all of those products for dry mouth. And I always say to patient, try one. If it doesn't work, try another one and see which one fit best for you. Of course, one of the things that is really important, like I say, most thing that we do enter through the mouth, okay? And so it is important as we pay attention to our health to also do a balanced diet, so that we can reduce the risk of diabetes and high blood pressure, and consequently gum disease and periodontitis. So I would say choose food with little or no added sugar, sodium, and saturated fat. Add seafood and dairy, beans, lentils to your diet. They're good protein, they're healthy. Use fruit and vegetable as snacks. Season food with herbs and lemon instead of adding a lot of salt. It's amazing what herbs can do. It makes food just taste so much better. And of course, drink plenty of water during the day. So I would just like challenge you, if you like soda and pops, to just reduce it. Try to do water. And another thing that people don't think about is your tea. If you're doing some herbal teas and all those things, is good for your health. It has a lot of water in it, green tea, white tea, and of course, if you need your caffeine, you can do dark tea, but don't do that the whole day. And of course, as a dentist, I will have to ask you to come to have a professional checkup. The routine checkup is really important. I know that, like I said, we don't always see inside your mouth. Some people have developed a high skill at smiling without showing teeth. So that they're hiding what is going on inside. But most of us get a cleaning twice a year. And I always say to patients, if you have that insurance, use it. It's actually not free. It's something that you've worked for one way or another. So come for your exam and your cleaning twice a year for people who are, just don't have any periodontitis, which is when you have like gingival disease that is affecting the bone. But if you have like periodontitis, then your hygienist and your dentist might ask you to come more than twice a year. Sometimes it's not that deep, and then we'll take like 3 times a year, and sometimes 4 times a year. But being able to remove those bacteria that have gone subgingivally is very important, because as we know, there has been data that shows that sometimes those bacteria can travel down and is associated with some heart disease. So it's very important to take care of those things. I know sometimes it's a little bit, because sometimes some insurance don't cover those extra cleaning, but if you can, it's really important to get them. And of course, one thing that is often neglected, especially for people who don't have teeth, that is what the word edentulous mean. Edentulous mean you do not have teeth, whether it is on the top, the maxilla, or on the bottom with the mandibular. The thing is, either way, when you don't have teeth, you still have to come for your exam at least once a year. Because when you come for an exam, a good dentist will start first from the outside. Make sure that your lymph nodes are not swollen. Make sure that all of your muscles are working well. Check that you don't have any temporomandibular joint issue. And also, when we look inside, we're not just looking at the tooth. We will ask you, to stick out your tongue so we can look at the fact that there's no lesion or anything. We'll look at the tissue in the oral mucosa. And for people who are wearing denture, we are also able to see if there is any kind of ulcers or infection that's being created. So do not think that because you do not have teeth, it means that you don't need to see the dentist anymore, because there are so many other disease in the mouth. People have oral cancer, tongue lesion, and so many other things that we can help you with just having better oral health and also overall health. So that is very, very important. And that is all I had for you today. But if you have any question, I would love to answer it. I'm going to stop sharing my screen.
Yeah, and unmute yourself so you can interact with Aniva. Aniva, thank you.
You're very welcome.
I learned so much. I mean, I didn't know about the different handles on toothbrushes that would help people who have dexterity issues. I mean, that's great. One simple question on toothbrushes. When you go to the store, they have soft, medium, and hard.
The recommendation of the dentist is always soft.
Really?
And that is because, some people brush so hard that they actually create recession, and recession, that is when you actually remove some of your gum, because the oral tissue is very, very thin. Actually, I remember when I was in school, in middle school, when we first learned about like biology, our teacher would ask us to go in and use our nail to scratch a piece of inside our mouth and put it in a plate. And that's the very first thing that I look at myself in a microscope, because you just scratch it out. They put us in a plate, put a little water, and so we can see cells and we can see our own cells. That's to just let you know how soft and gentle oral tissue is. And I always tell my patient, is soft, gentle, circular movement. It's not like this, and it's not like, I always tell people, put your music or put whatever makes you happy. Don't go to brush angry, right? Like it's self-care.
I have tried some of the mechanical toothbrushes, and they just make me giggle, and then I just drip all over. And so I've given up on them and just use the old-fashioned hand method.
It can also be deafening.
Deafening?
To make a sound.
Yes.
Not what you want in the morning.
But talking about sound, I know that particularly for people who have a tendency to apply a lot of pressure and create recession for themselves, the electric toothbrush has the advantage that a lot of the new one will actually make a noise when you're pushing too hard. So, or the sound will change. So let you know, like it will be the smooth sound, and then when you push too hard, it's letting you know, like, okay, release. And now some of them have all kind of like light and stuff. And I can tell you, I've tried a few of them, and I like my basic toothbrush. I don't want a particular, the new one that have Bluetooth where you gotta hold your head in the mirror and look. I'm like, that's just a little too much. I don't want to do all that when I'm brushing my teeth. But it can be useful, particularly for young children as they are learning, because it will literally tell them if they miss a spot.
Oh, okay.
Interesting.
Harriet.
I have heard or read that baking soda and water would be just about as good a toothpaste as paste. And I'm, of course, trying not to buy big plastic tubes. I'm hoping my dog isn't going to bark. And I wondered whether that was true. In other words, what dentifrice means is friction. Sorry. And I'll mute myself. Do you have an answer to that?
So I would tell you that baking soda is not something I advertise. And one of the reasons is it is quite abrasive. So actually, as we, because the older we get, right, the more of the enamel layer, which is the layer that doesn't hurt, that allow us to eat, we are losing. And baking soda is really abrasive and help us take more of it out. In your normal toothpaste, you do have a little abrasive material to help, but it's not as much as what you have in baking soda. So, and I know that a lot of people have used it in the past, but I do not recommend it. And most American Dental Association doesn't recommend it because of the
I sort of assumed that, and I've never done it. But is there any way to get around using toothpaste? Is toothpaste really that useful? Is the fluoride in toothpaste important, useful?
The fluoride is really important because fluoride is like the main reason that, you know, people do not have as many cavities. You have children now.
That's not internal, that's external?
Yes, you have it in the water. That's why you have fluoridated water.
And that's not because you've swallowed the water, but because the water on your teeth?
That's like touching. And that is why actually, you know, I always tell my patient, because a lot of people brush their teeth and then after they brush their teeth, like take a cup and just rinse. And actually you shouldn't do that, because if you're using toothpaste which is fluoridated, what you want is once you finish, you spit it. You know, you can rinse your mouth, the outside, but don't rinse your mouth. The same way that when the kids come, we actually put the extra fluoride, but we ask the parents that to avoid giving them anything to drink or to eat for 30 minutes. So you have that fluoride in the toothpaste, and it's defeating the purpose to just go and rinse it right away.
Okay.
Susan, you had a question.
Yeah, I was going to bring up fluoride in the toothpaste because my husband, I think he was doing the baking soda thing and then he got cavities, you know, out of the blue. So the dentist said to go back to using toothpaste with fluoride, and
Yes.
that's really important. But I've also read that different toothpaste erode the teeth different, you know, some are stronger than others, and you should be careful which toothpaste you use. And I think Consumers Reports had an article ranking them on how much they abrade the teeth, the enamel.
I will tell you, I haven't read about that, but honestly, most toothpaste, if you look in the back of it, have the same ingredient. The big difference is the flavor. So that's why when my patient come and ask me like, okay, which toothpaste should I use? And some of them will tell me, well, you know, I use Tom's of Maine because it's natural or anything. And, you know, I hate to tell that to people, but Tom of Maine is owned by Colgate. So it's kind of like, you know, I mean, I tell people it's like clothes, right? Like the overall company that owns Gap, Old Navy, and Banana Republic. So depending on how much money you got, they're targeting everybody, the less poor, the middle class. So the thing is, you don't have that many company owning, you know, the toothpaste company, the same way that when we look at TV, there's really like 2 or 3 big company that's like broadcasting everywhere in the world. So,
yeah,
you know, I don't tell that to my patient because I'm like, oh, you're happy with Tom's, and go for it. Because they would tell me, oh, I hate Colgate. You know, they do that and that. And then I'm like, good. I mean, if that one works for you, go for it.
I think that's your best line so far. And that's a
So,
great piece of information.
Another thing about electric toothbrushes is that they tell you when 2 minutes is up. And
Yes.
so I think so you shouldn't do it more than 2 minutes.
Or you should, for me, I rarely have people that do it more than 2 minutes. Most people do it way less than 1 minute.
Oh, it gets you to do it for, it reminds you to keep going until you hear.
Exactly.
Yes,
And,
it's
and a
very
lot
handy.
of them have the beep every
Yeah.
30 seconds. So it reminds you, you should go like if I'm starting on the bottom, on the right, on the outside, so I should go 30 seconds, and then I go on the inside 30 seconds, then you go top another 30 seconds, and you go on the inside. So
Yeah.
that gives you your 2 minutes.
Right, right. So I find that helpful in the morning because, my mind isn't so clear and it just reminds me. So, and then the final thing I wanted to say, which I think you said very nicely, is that teeth and gums are so important for your overall health. It's I guess it's the gums
Mhm.
that go directly to your bloodstream, maybe. I'm not sure I understand all the
Yes.
physiology,
I mean,
but
it's the thing is that it's connected. The blood aliments your entire body, right?
yeah,
So when I cut something in your mouth, you have blood. It's the same blood that
just
goes
goes
all
into your
over.
body. Yeah,
Exactly. The same
Yeah.
way that if you cut your finger and for some reason it doesn't get healed well and you get infected, then everybody becomes septic from a wound. The wound doesn't have to be closer to the heart. It's just somewhere in the body because the infection got to that place. And that can happen in your mouth.
yeah.
And
that's
the
why-
thing is, it's not disconnected.
And that's why people who have heart valves or other heart apparatus or have had a past history of myocarditis or something, when they go to the dentist,
They need
are
to take
given an
antibiotic.
to prevent that infection from starting, just because you are manipulating the gums in the mouth, and the mouth is not a sterile environment at all. So, and if you have gingivitis or other infections in your mouth, you are at much higher risk of developing septicemia.
The amazing thing is the mouth is not a sterile environment, but it is at birth. A baby does not have any bacteria in the mouth, which is why mothers oral hygiene is really important. Because as we kiss baby, as we taste food and try all those things, we are transferring. So there's a correlation between the bacteria in the mother's mouth and the bacteria in the child's mouth, which is why maternal oral health is really, really important. Because if a mother doesn't have a good oral health, usually her child won't have such a good oral health because they're eating the same kind of food, and they just tasting and, I mean, it's hard not to kiss a baby.
Yeah. And you'll see mothers pick up a pacifier and put it in their mouth and give it to their baby, and you're just transferring the germs there, and hopefully they are family germs anyway, and so it probably won't make a big difference. But the other thing that I found fascinating in your talk, lots of things I found fascinating, but dry mouth, I didn't realize that was such a big issue. One, that it was very common, and two, that it was of real concern.
It is. We have quite a few people who are elderly, and especially when people are taking many medication, who suffer from dry mouth, and it doesn't just affect the fact that their mouth is dry, but it also affects their nutrition, because food doesn't taste the same. Because when you have dry mouth, is the papilla on the top of your tongue, which are the one that allow us to taste, right? I kind of dying, and it's become smooth, and so food doesn't taste the same way, and it affects people's quality of life.
But you said it even increased in infection and so on.
Oh yeah, because when you have dry mouth, you don't have enough saliva, and saliva circulate things. If it's dry, it stick more. And so it increased plaque, it increased cavity, and a lot of time that's why, and it's normal as we get older, we get drier. It's a really bad thing to think about, but it's true. I mean, that we see it as we wrinkle and all that kind of stuff. And so in the mouth, it is normal to have less saliva. But when we really have dry mouth, those people get what we call root decay, because it's like everything is dry. It's kind of like, because I always tell people that I look at the tooth like a tree, and your bone is like the soil, right? And if you don't have saliva and all of that is dry, it's like your roots are they don't have what it needs to actually be maintained and for your tooth to be healthy. And that's why you see those people that have like decay right at the margin at the root, because all of that area is dry.
Judith.
Yeah, I had a couple of questions. Now that I'm back visible. First of all, how do you define dry mouth? In other words, I sometimes have a very dry mouth, but I don't have any of the things that you listed as being, I'm not aware of any of the things that you listed as being there. And I think it's just thirst. And so in a way, how do you define, how do you know whether you have it if you don't have the symptoms you listed?
I think that the thing is like everything is on a continuum, right?
Yeah.
So
sure.
the thing is like, I mean, do you have people, I listed some of the common symptoms. It doesn't mean that everybody has all of the symptoms.
Sure.
But, the biggest thing, which is why what I mentioned in the balanced diet, is we have to keep hydrated throughout the day. So, just, and we also have to know that if we eat healthy, we also get water through our food, because vegetables have a lot of water, fruits have a lot of water. So, it's just like making sure that we do not do things that will actually increase, our the possibility that we get dryness, because as we get older, all of us will get like drier. I'm telling you, for those of us who are dentists, there's not anything harder than working in the little kid's mouth. It's like a pool of water in there. Like kids are just like so. And as people get older, you don't have the same problem. That's for all of us.
Okay, thank you. Now that's helpful. My other question is about bonding. I just recently decided I hated my front teeth because they were all chipped, and they kept chipping. And my former dentist did bits and pieces of bonding, and they'd fall off. And so it's a long story, but anyway, they were going to cap teeth, and it turned out to be too complicated because they'd have to move teeth in the bottom in order to cap teeth in the top, and it just sounded very expensive and risky, and the result could have been pretty horrendous. So I asked if bonding was a possibility, and it seems to be working so far. But is this something that's healthy and that you advocate and that works for people? I had to think of it myself. My new dentist didn't actually suggest it. But
what is bonding? What is bonding?
Well, bonding is when, so let's say you chip the tooth or you have a little piece missing. What we do is we take composite, which is the white kind of filling, and we kind of like, sculpt it so that it looks okay. And usually I would tell you that bonding, it's fine. Now, one issue with bonding is, as you have to repeat bonding, right? Yeah. The way that we do the bonding is, as you may recall when your dentist did it, you have to abrade the surface a little bit, just so to make it so that it bonds, so that it stick. And the thing is, if you have to do it too often, every time we, abrade the surface, we're taking some of your tooth out.
Right,
right?
right.
And so we're getting closer to the part where you have sensitivity.
I see.
So
Okay.
that's the only thing. And I always tell patients that, you know, it's the same thing with bleaching. I tell patients when they want to bleach, particularly when they're older, I tell them, I would not do bleaching on my mama because I love her. And the
That's
other
great.
thing is, contrary to what people think, if you get to a certain age and your teeth are super white, it does not look natural. A little kid will tell you that it look fake.
Right.
So,
Yeah.
you know, bleaching, when we do it, we have to protect the gum, and the bleaching material, if it were to touch your gum, will actually ulcer your gum. That's to tell you how, you know, how abrasive and how potent it is. And, you know, if a person get older, and I already know that the enamel layer has lived through their life, I'm not going to do that.
Yeah.
You
Yeah.
know, I always tell my patient, I'm very honest with them. You know, I have the advantage, and I call it a calling because it's my choice to work in Federally Qualified Health Center, which means that, you know, I'm not trying to make money out of this.
Mhm, mhm.
So I'm going to tell you what I think, and I'm going to tell you honestly, I wouldn't do it on my mama.
Great.
You know,
Yeah.
and I try to tell my patient, I try to treat you like family. And there's case where bleaching is totally indicated. You know, some people sometimes have had trauma, and you get like, you know, a dark spot and stuff, and
Right.
we can remove it. And at certain age, it's okay. But I think once people pass a certain age, the benefit, I don't know that it outweighed the risk.
Right.
Jean, you had a question.
I just wanted to share my experience. In this past year, I guess, I don't know, some months ago, I started to wake up in the morning with a dry mouth, noticeably dry, different from before. Never had that before. I have a very good dentist, and what you have said here is supportive of my dentist. His recommended is similar. But I asked him about the dry mouth, and the technician said, she gave me a sample of a Biotine mouthwash, dry mouthwash. And the dentist said, before you go to sleep, drink a glass of water. And for now, for me, that has been enough to, you know, completely lessen the way my mouth is feeling in the morning. But I feel as though I'm 83 and I just started getting it. So,
Well, it's
And
interesting.
hydration
I'm now
is
alerted
key.
to it. And I know that there are different products beyond the mouthwash that I'm using at night.
Mhm. But
I thought it was
water
interesting.
is very important, you know, really drinking water the whole day.
Yes, and here just say you start off you drink water through the day, but just before you go to sleep is a good time to have a glass of water.
I think many of us hesitate to do that because we're going to have to get up and pee anyway
Right.
all the night.
know.
And why get up a third time? But I have noticed that I have a cup of water right next to the toilet. So when I sit down to pee, I take a sip because I think I am drier at night.
Mm.
And
I would-
sometimes it's also because some people, you know, breathe through their mouth at night. So
Yeah.
that also,
Yeah.
you know, play, because as you breathe through your mouth is open, so it gets dry.
And when we get winter again and we all have the heat on, it
Mhm.
really can dry out quite easily. I was actually surprised you said mouthwash. I figured that was just a so-so deal, that it didn't really do anything to help your teeth. It was just, come on, you can smell better if you use mouthwash.
But
But
my dentist is big on mouthwash.
Really?
He's always used it. Bacteria, that's what he said.
Exactly, because a lot
Whatever
of
he
them
meant
have
by that.
antibacterial, and as people get drier mouth, and you know, sometimes people say like, well, you know, my mouth smell bad. I think that, you know, the mouthwash, well, it's a simple way to just like make it better. And the thing is, I always say, honestly, I'm gonna tell you, Miss Pat, mouthwash is indicated, it's not an absolute. But like everything, if you put it together, it compiles, the good effect on it, right?
Mhm.
And so, and now, like it used to be that mouthwash were done just for like feeling good and smelling good. But
Yeah.
now if you look at them, they have improved so much. They have anti-cavity, some of them are high in
Yeah,
fluoride.
good. Yeah.
Actually, for some of my patients who have a lot of cavity, I would recommend the ACT mouthwash,
Mhm.
ACT,
Mhm. Mhm.
because the ACT mouthwash is higher in fluoride. We also
Mhm.
give it to children when children are small and are prone to cavity. And sometimes also, if the regular toothpaste does not help you, ask your dentist, and they will prescribe Prevident, which is a higher fluoride content and help with prevention of cavity.
But mouthwash is another additive that can help with decreasing the bacteria in your
Good.
mouth.
Mouthwash.
Interesting.
Yeah,
Yeah.
if you look at some of that called like Total, they've got like, help with gingivitis, help with bacteria, they have fluorides that help with cavity. And I would say 15 years ago, mouthwash was just probably a smell good, but
Yeah.
things improve.
Mm.
Okay,
Good. Yeah.
interesting.
And what about hydrogen peroxide? I'm supposed to do mouthwash in the morning and hydrogen peroxide mixed with water after flossing at night.
Well, I like the mix with water.
Mhm.
Because the thing is, when people have things like ulcers and stuff like that in the mouth, hydrogen peroxide can actually not be so good. So, it really depends of like how you use it and when you use it. I would
Yeah.
tell you, if you have any kind of lesion or anything that feel kind of like painful in your mouth, people used to always come to me, particularly older generation, and say like, oh, I do hydrogen peroxide. And it's like, warm water and salt.
Okay. Yeah.
Warm water and
Oh, that's
salt is magic. When you go to the doctor, most of the time, if you have to stay in, they will put saline. It is amazing what warm water and salt would do. So it's not as, it doesn't irritate.
Mhm.
So, but if you mix yours with water and stuff, but I know some people would tell me they used to do it like every day, and I'm like, but why?
Interesting. Okay. That's helpful. Thank you.
You're very welcome.
Change in mouth size. I used to have a prominent split between my two front teeth, and it has disappeared. And I used to be able to floss with ease, and now it seems really tight between my teeth. So I'm theorizing that my mouth structure is changing. Does that happen as we get older?
So the thing is, it's more like the tooth. So tooth have mobility, right? And the thing is, as we get older and we lose some bone, remember I told you about like the tooth being a tree and the bone being the structure that hold it? Like when you go outside and for some reason a tree has lost like some of the ground, you will see little movement. And so that's one thing. And the second thing is when teeth move, like let's say today you had an extraction in between two teeth, what will happen is this happen. Teeth are attracted to each other. They want to touch. So if you have a gap, they will tend to want to close the gap, which is why in young kid, when for some reason they lose like a molar, but their second molar hasn't been there yet. The hope is that if the molar was taken, the first molar was taken early enough, then what's going to happen, that gap is going to close because they're young. It's totally going to close. And so as we get older, things shift. That's just like, you know, it's kind of like, actually, I just talked to my godmother. I mean, I saw her last week and she was just like, it looked like you're taller than me now. And I think it's just like, you know, the way that as we get older, we kind of like, you know, it felt like we shrink a little bit.
Shrink.
We do.
Yeah,
We do.
more than a little.
We're all aware of that. Well, this has been a fascinating discussion. It really
It
has. It's
really
generated,
was.
yeah,
Really good.
generated a lot of questions, and I certainly have learned a lot. And this is great. I am definitely going to be referring our other members to listen to the recording
Mhm.
because, and I'm sorry they're not here to be able to ask you questions individually, but this has been fascinating, Aniva. It's really good.
Well, thank you. Thank you so much for having me. It's a pleasure
thank
spending time with all of you.
Yeah,
Thank
well,
you.
it's our
Thank you
pleasure
for
to
your
have
time.
you. Yeah, it's
Thank you.
really great.
Yeah.
Thank you so very much. Now
Thank
go out and
you.
enjoy the sunny day.
Thank you
Now
so
I still
much.
have some